Hi there. I have been missing for a little while. I have not been well. So, when you're not doing the best, you need to take time for self-care. It's so vitally important to take that time and not be okay for a little bit. Get your strength back and then get your attitude back and go out and conquer. I spent quite a bit of time in the hospital and having to recover, and now I'm back at home and hydrating and back on some medicine that will hopefully do me better. Well, we'll see. Time will tell. It's not an immediate thing, but I wanted to kind of pick up where I left off with my journey. It did start for me from diagnosis in April of 2018, and we kind of covered all of that, and I can rant until the sky falls in about making sure that you are heard and keep seeking opinions and talking to doctors, nurse practitioners, radiologists, anybody that will listen, to not get that pat on the head about, it's female trouble, see your OBGYN, because I feel like sometimes they get a little jaded too, and they don't really listen, because there are so many that want to claim that the sky is falling when they're just overcome with their symptoms. And then for us that do have real symptoms, we continue to get turned away until it gets to this level. But I did have the hysterectomy, did have the lower lobe of my left lung taken, and it was just a year after that they went in and finally took the fallopian tubes and ovaries. I get a lot of the times and dates mixed up because there's so much that happened in so little period of time. It feels like, to me anyway. And then trying to decide what to do for treatment was just a lot of hormone blockers for a long time, because they say that this cancer runs off of hormones, and they feel like the only known thing to do is to stop all hormones in your body completely, so that they can try and slow the growth. Because obviously slowing the growth, if you can get that to stop, then they can start looking at how to shrink tumors. It's a long and frustrating process. You either have too many opinions, not enough opinions, some opinions that you just want to swear at and tell them, your opinion's not needed. And then the opinion of the people you want, they really don't have anything that they can say, because they're like, I'm at a loss at this point. That's why we brought in all of these other opinions. So I did miss treatment yesterday and meeting with my oncologist yesterday because of the hospitalization. I did have to go to one of my more local hospitals rather than to be at the James at OSU. I had talked to my oncologist, and they felt like that was the best thing to do, because rehydration for me was the most important thing, because we didn't need to go into ketoacidosis because I am diabetic as well. We didn't need to have any more damage to my bladder, since I do have a tumor metastasized there. Rehydration was the most important thing. So I followed my oncologist's advice, and I went to a local hospital, which is Berger Health Systems. I was there in observation for over 12 hours, receiving just bag after bag after bag of saline solution. They did a chest x-ray, they did an abdominal CT, they ran a ton of blood work, just trying to make sure that it wasn't appendicitis that was causing all the symptoms of vomiting, of the diarrhea. I mean, it hit so hard and so fast. I think that's something else that's not talked about a lot, is that when your system is so broken down from cancer, you're so susceptible to everything, like everything. And what could be a 12-hour flu for some people can be life-threatening to us, because it hits hard and fast. And in a matter of 6 hours, I was completely dehydrated. You could literally pinch the skin and it would stay. There was no moisture in my mouth, in my eyes. It was bad. It was very, very bad. And going to the hospital was the best choice. And the amazing staff that's in the emergency room at Berger Hospital they were the sweetest people. They explained everything so well about every process that was going to be happening, about their correspondence with my oncologist, making sure that everything was uploaded to my MyChart and to Epic, so that both hospitals could see what was going on, so that they could be in communication with each other, so that they could decide what was the best route. We had some blood work that looked a little shady for a little while, so there was talk about going ahead and transferring me to OSU. Luckily, on the next blood draw, that was only 2 hours later, those margins had started to move. So we're not even going to speak that out into existence, because it didn't happen. So that's good, because when you've had cancer in 5 organs of the body, you're no longer a candidate for organ transplant ever. So if anything comes up with your heart, your lungs, bladder, liver, you can't be placed on a transplant list because you've had cancer in 5 organs of the body. So it becomes a lot more complicated. I have gotten the oncologist and treatment back on the schedule, so next week is going to be horrific, with all of the running that needs to happen, and all of the appointments and the treatment and the tests and following up. I have to see a cardiologist. I have to get back to my pulmonary doctor and thoracic surgeon, so they can check on a few things. I need to meet with my pharmacist because some of the meds have to be altered for insurance purposes. It's never ending. It really is never ending when you're fighting cancer. But luckily, I'm still here, and it's a day at a time, and moment at a time. And I took the time that I needed for me, and now I'm back. If anybody ever has any questions, feel free. I've had a couple of people reach out and ask other questions, and that's fine. And I try to get back to those. I have to take care of me first before I get back up on my platform for women's health. Uterine cancer, cervix cancer is no joke, especially when you're dealing with something that people rarely see. So there's no set treatment. There's not enough research. So if you do get diagnosed with endometrial stromal sarcoma, join a research program. Let's pave the way for those that come next.